Hey everyone, it's Tammy for Fight For You Coaching. I'm continuing my series, It's a Nurse Thing, and today I'm going to talk to you about things that we nurses wish we could tell you while you're in our care. The first thing I'm going to talk to you about is letting you know that we always stay calm when we're taking care of you, no matter what. If we're not calm, then you're not calm. So we may break down afterwards or have a little mini deep breath moment, but while we are with you, we are constantly calm. We will never say to you when you come to the ER or the hospital, you should have come sooner. We may think it, but we'll never say it. Your life is in our hands, literally in our hands. So I do question orders and treatments if I feel necessary because I want to ensure that you're getting the best possible care that you can get while your life is in my hands. We are taught from the beginning that if it's not charted, it didn't happen. So if you continuously see me writing things down, it's because I need to write them down to remember them. And if you want to see what I'm writing down, just ask. I have never had an issue showing you what I'm writing down. It's not a secret. I just have to write it down so that I can remember when I do your assessment and stuff, what I need to chart. There are germs everywhere in the hospital. So when you see me gel in, gel out, wash my hands at your sink, it's not because I think you have something and I don't want to get it. It's simply for your safety as well as mine. There are germs everywhere. So if you see any kind of staff member, nurse, doctor, anything that comes into your room that isn't gelling or washing, ask them to. That's your right. Patients don't get admitted these days, guys, unless they are really, really sick. So there are no easy days for a nurse. Most patients are really sick, so if it takes us a couple more seconds to answer your call light, be a little bit more understanding with us because we're probably helping somebody else. We're not intentionally ignoring your call light. Please don't ever say to a nurse, "You're too smart to be a nurse, you should have been a doctor." If I didn't want to be a doctor, I didn't went to school to be a doctor. I wanted to be a nurse and take care of patients, so that's why I'm a nurse. I will always come into your room with a smile on my face, and if I don't, ask me to leave. You have any right to ask anybody to leave. Everybody that comes into your room to present you with care should have a smile on their face and treat you with 100% respect. I also, and this is probably one of my favorites, and it's kind of poking fun at you guys a little bit, and I don't mean it in a bad way, but you guys, I also watch Grey's Anatomy, but I strictly watch it for pure entertainment. I watch it sometimes to make fun of the things that they are doing. So if you come into my ER or hospital and say, well, that's not the way they do it on Grey's Anatomy, you can bet that I am going to be making fun of you inside my head, not to your face, but I'm going to be laughing at you just a little bit. Remember when you come to the hospital that that's exactly what it is a hospital, not a hotel. I can't give you the results to your test, so when I tell you that it's the doctor's job, it really is the doctor's job and it's not an excuse. I cannot give you any results to any of your tests. And I know that sometimes patients don't understand that, and it's not an excuse from the nurses. We really can't give you the results to your test. The doctor has to do that. Know that nurses get blamed a lot, and it's not their fault. So the next time that you may be quick to blame, remember that it might necessarily not be that nurse's fault. A positive note is always good, or even a thank you to a nurse is always good. It can brighten her day, her week, or even her month. And last but not least, you guys always remember this. We still believe in miracles as well. Have a good afternoon, guys, and I can't wait to talk to you again soon. Bye.